My name is Amanda Loomis. Let's see here, I was born and raised in Rhode Island actually, and went to the University of Rhode Island for pharmacy school. I graduated back in 2020. So right at the start of the pandemic, I graduated. So it's an interesting start to my career. But I'm so glad I chose URI for pharmacy school. I wanted something that was a 0 to 6 because I knew what I wanted to do. I wanted to be a practicing pharmacist. So I really liked how incorporated everything was to just get me to my goal as fast as possible. I also really liked the environment at URI. So it was very friendly. It felt like a home away from home because I did live 20 minutes away. And in Rhode Island time, that's pretty far away. So I lived on campus for my first few years. But yeah, I loved it. The faculty was really involved as well. And, you could tell that they genuinely cared about their students. So those are a couple of reasons why I picked URI, but I don't regret a thing, and I'd do it all over again if I had to.
I totally agree. The faculty are some of the best parts about URI. Everybody's so awesome, and even opportunities like this, being able for me to connect with you and for you to connect with me, and then for other people to be able to see it. It's such a great idea that they came up with, and something that's really awesome for everybody involved. And so my next question was just what is your current role in pharmacy? And then we'll get more into it too.
All right, so my current role, I am now the PGY-2 Geriatric Pharmacy Resident with the University of Maryland. So I'm down in Baltimore.
Awesome, that's so exciting. So obviously you did a PGY1. So if you want to tell us a little bit about what your PGY1 residency was like, where it was, and then a little bit about why you were interested in doing geriatrics for your PGY2 specialty, and then maybe a little about your current program, why you chose it.
Yeah, so I did my PGY1 with the Connecticut VA healthcare system, and I knew I wanted to go into geriatrics, so I wanted to steer my learnings sort of towards the VA system because you work at the top of your license. I also knew more about the program, and the program really is very well rounded. And so I felt like even though I wanted to specialize in geriatrics, and even though I knew that, the VA still gave me this opportunity to explore other aspects of pharmacy. So while there, I actually realized that I really do love hospice and palliative care as well. So that's not all geriatrics, much to some popular beliefs, but I do enjoy hospice and palliative care as well. And I really liked inpatient a lot more than I thought I would too. So in general, the VA in Connecticut was fantastic because it gave me the opportunity to explore things that maybe were outside of my comfort zone, and then get me a good general knowledge base to really start my pharmacy career in the right direction.
Awesome. And then, so you touched on why you were interested in geriatrics. So if you want to talk to us a little about why you chose your current site at the University of Maryland for your PGY2, was there anything particular that really stood out to you?
So I knew that I loved geriatrics, but I'd have to say I love a lot of things in pharmacy. There's a lot of things that I could do, but I couldn't not do this. I had to do geriatrics because I couldn't not do it. So that's sort of why I picked geriatrics, because it's really where my passion lies. And I know that if I didn't do it, I would feel like I'm missing something in my career, since it is such a passion of mine. And, the population is a population that I really care about. So that's sort of why I picked geriatrics. As far as my current program with the University of Maryland, so I love the layout. I love what I get to do. It's very different from the VA. So the VA was very much, I was in the VA and I, went around the different types of rotations throughout the VA. So I got to see a lot, but with coming into the University of Maryland, I have a lot more teaching responsibilities, which is very interesting. I love precepting, so I get to do a lot of that. Also, it's just, I'll be in so many different types of care centers. And as much as I loved working for the government, I also want to use my residency to push me out of my comfort zone and experience as much as possible. So this residency, with all of the different rotations, it really allows me to hop around and find out what I like, which isn't something you'll get to do really as easily if you were to just go straight into your career. So I'm glad for the opportunity and grateful that I get the options to try out a little bit of everything. I also really liked the rotation style. So right now my schedule is set up where I'm in block rotations, and then starting in the end of September, I'll have longitudinal rotations. So that means that I'll be at a different place every day of the week. And then I do that for the rest, like the 3 months until December. And then it starts over, we'll have block rotations and then longitudinal. So it'll give me the opportunity to really get to know the places where I'm doing rotations, but then also I get that longitudinal aspects, which will allow me to really get to know my patients and follow them long term. So I wanted both aspects because I really like both, and that's my schedule now. So I'm really excited about that.
That's really awesome. And I feel like too, since it's like a big like university hospital, you have like more opportunities to like be in different places versus like if you were at a smaller institution. So I feel like that's really awesome that you get to be able to explore different areas, like you said, and get to experience different things and follow the patients actually long term and not just for like a month or something. And you'll be with them pretty much until the end of your residency, which is really cool.
Yeah, it was definitely fantastic. I mean, I still get rotations at the VA since the Maryland VA is so close. So I do still get a little bit of a taste of everything.
Oh wow, that's so cool. I didn't even realize like that was like possible. I didn't realize that was like a part of like programs and especially like with a program like that. That's so awesome. Because
Yeah,
geriatrics is very like broad too. So it's not like you're focusing on just like infectious disease or just like cardiology. Like you're seeing kind of everything, just applying that
yeah,
to the geriatric population, which is really awesome. And
exactly.
you just kind of going back to like what made you interested, did you take any like geriatric electives at URI when you were there?
Yes, so actually, I completely credit this to Dr. Erica Estes. So, going into my interview, before professional years, I said, I love a lot of things in pharmacy. I love everything, which is still true. I still love a lot of it. And but I said, I love everything, but at least I'm 100% sure I don't want to do geriatrics. And so here I am, the geriatric pharmacy resident. And so that didn't really turn out as I exactly had planned. But Dr. Estes had reached out to me for one of my IPI requirements, and I ended up doing a program called Cyber Seniors, which is where you teach older adults how to learn about technology. And I loved it. I absolutely loved it. And I wanted to push myself more. I think that's why I was a little hesitant about it at first, because it's a population that I really care about. And I was nervous that I wouldn't be the pharmacist that they need. But with URI, I was able to take both geriatric electives, the one for the P2s and the one for the P3s. And that really prepared me to be where I am today. I learned more about, the field itself. I learned more about what it is that my passion is and why I'm so passionate about it. And I really was able to develop myself into the professional that I am today. And I'm here. I'm at my PGY2 in geriatrics, and even going through orientation, which I'm finishing up this week, I feel like my baseline knowledge, because of URI, with the help of my PGY1, is fantastic. I feel prepared to go into my rotations with residency and be the pharmacist that maybe I didn't think I could before, that I was nervous I wouldn't be able to be. So I'm confident now that I can be the pharmacist that my patients deserve. And that's really amazing. And I am so glad that I went to URI and did my PGY1 as well. And now I'm in my PGY2 to be able to do that.
That's so funny. The way you explained like how you didn't want to do geriatrics because I had like the same experience. So I took like oncology like the last semester, and like the whole time I was like, I don't want to do oncology. I am terrified of oncology. I do not want to be an oncology pharmacist. I'll do anything but oncology.
Mhm.
I took oncology and then I was like, I've decided I want to be an oncology pharmacist. And it was just so funny because I had the exact same experience. Like, I was like, no way. Like, I'm terrified of it. Like, all these, like, really scary sounding drugs. There's so many new drugs. There's so many drugs in general. Like, I was like, no way. Like, this is not for me. And then I started, like, learning about it and learning, like, the role that, like, pharmacists have. And I was like, okay, never mind. This is what I want to do. And it's just so funny because like you never know until you like have those experiences like you had with like cyber seniors or
Yeah.
what you did with like your PGY1, especially like being at a VA. I feel like you get a lot of exposure to geriatrics just because a lot of them are like retired veterans, a lot of them are older. So you get to see like so much, I feel, especially at VAs.
Yeah. And you're exactly right. You never know what you're going to like. So use your residency, your PGY 1 year, use URI and all of its resources to really dig in and figure it out what it is that you like. Use your appies, just everything you can to get out of your comfort zone. Maybe do that thing that you think you're going to hate a lot, because who knows, you might actually really love it. I'd have to say that's another piece of advice is that I have is when you're really saying you have strong feelings about something, ask yourself why. Really dig in there and figure it out, because turns out I just was afraid I wouldn't be good enough, but I had the tools around me, and I'm making sure that I still have those tools to be the pharmacist that my patients deserve.
That's awesome. And I totally agree. For a while, I was feeling like the imposter syndrome and I was like afraid of oncology. And then once I learned it, I was like, this is like where I'm meant to be. Like, it's like so funny the way like it works out like that, especially like for you and me having this
Yeah.
conversation. And then, so my next question was, you kind of touched on this a little, and I know you said like every day is different, but just maybe talking about like a day in the life, like at your current PGY2, maybe some like what are your like key responsibilities and things like that.
So I'd have to say you're definitely right. My schedule is kind of all over the place, so no day looks exactly like the next. Some consistencies though. There is consistency, especially in residencies. You're going to have longer projects. So I have a longer project that I'm working on, so having meetings for that. Also meeting with my program coordinator and my program director to make sure that I'm setting up goals and making sure that I'm developing the way I want to professionally, and that if they can provide me any sort of support, they want to know about it. It's it really is great you have that support with you there every day. But you also have the independence. So it's nice because you get to lead a project and it's something you're passionate about, which is amazing to be able to do what you love every day. So I'd have to say there's that consistency right now. I love my day to day, and I'm involved in research. Let's see, outside of that, right now, I'll actually talk about my current rotation. So I'm staffing. I'm training to staff at a long-term care pharmacy. So right now I'm learning the computer system, and I worked in a long-term care pharmacy as an intern, so I have a bit more of background on how the whole process works. But it's really like you're getting thrown into the workplace, but you have support to help you. So I'm getting trained with incredible pharmacists, and I get to see a little bit of each different type of pharmacy. So that's the rotation that I'm doing right now. Also, you can stay involved in policy things if you'd like to, and advocacy. I'm a member of the American Society of Consultant Pharmacists, or ASCP, and one of my rotations, I actually finished that a few weeks ago, was with their association. So I got to work with the association itself and learn more about advocacy and things like that. And now that's something I'm going to carry with me for the rest of the year and stay involved in, because that's one of my goals as a professional, to be involved in advocacy. So I'd have to say you bring things forward with you through all the rotations. I'll be starting another block rotation next week, which is long-term care and hospice at the VA. So that's exciting. And then I go into my longitudinal. So something new every day. But yeah, no matter what though, you're always supported, which is amazing. You've always got little projects or big projects in the background that you have to keep track of, which can be a task, but is also a really incredible feeling to be that independent. And then you get to help people every day, no matter what setting you're in. So that's amazing.
That's so great. And speaking of goals, what are your future career goals? Like, what do you have anything specifically in mind, or are you still kind of like testing the water, seeing what you like?
So I thought I knew exactly what I wanted to do. Again, I was dead set on something and the universe is like, just kidding. That's not how it's gonna happen. So again, keep your mind open because things don't always work how you plan them, but it doesn't mean they don't work out well. So I always knew I wanted to be a geriatric pharmacist working with an interdisciplinary team with doing chronic disease state management for older adults. Now, I would still love that. That would be amazing because it is something that I'm passionate about. But I also am taking classes right now with the University of Maryland as I'm doing my residency to hopefully eventually finish up their master's in palliative care course. So I would like to incorporate palliative care and hospice into my career in the future. That's something that my RPD and everyone is helping me with too, is figuring out, what jobs there are out there that I could potentially jump into that incorporates a lot of what I like all in one. So I'm exploring, and I don't really know. I don't have a final answer, but I think that's okay because I'm a PGY2 resident and it's okay to not have all the answers sometimes.
100%. That's so awesome. I didn't even know you could get like a master's in palliative care. Like that's so exciting because I know in your bio, like you said, that is something you're like interested in. So being able to combine that with like your knowledge that you're getting right now with geriatrics is like so awesome.
Yeah.
So when do you finish the master's program? Is that like
So I'll be doing the master's program while I'm in residency. And by the end of residency, I'll get a graduate certificate in palliative care. And then I think it's a year and a half or 3 more semesters to finish the entire master's degree. So that's not a lot of time. So I'm really excited about it, and it's online courses as well. So you can really be anywhere and do it, which is great because it allows me to be a little bit more flexible in the future when I'm job hunting.
yeah, I was going to say that works out perfectly since I was going to ask you, was it online? So that works out great. So whenever you get a job after your PGY2, then you'll be able to really do it from anywhere, which is really awesome.
Yeah.
And then, so I just wanted to know too, what your favorite part of your residency is. I know it could be your last one, because I know you said you're still training on this one. You could say what your favorite part of your last one was, and I feel like it's going to be hard for you to narrow it to just one. So if you have multiple, feel free to say.
Okay. That is really hard. So I will talk about my PGY1 because again, I'm newer to my PGY2, so I don't know what's my favorite yet. I have yet to explore it all. But as far as my PGY1 goes, I really did love it all. There are varying levels of how much I loved it, but in general, I really loved my entire PGY1 residency. So I'd have to say my favorite was probably working with their COE, which is the Center of Excellence in Primary Care. That might not be the updated term for it. I apologize. But it's fantastic. They have basically this whole team that takes care of our complex older adults. And the pharmacist is a part of that team. And we work with all the other professions to learn. So we have interdisciplinary didactics and, they talk to us and do topic discussions, and I talked to them and showed them how to use all the different inhalers and how to pick between them just based on device. So it's really great getting that interdisciplinary experience. And then that was actually one of my longitudinal rotations. So once a week, every Wednesday was my clinic day. And I had the same patients all year since January. And I called them and I followed up on things like blood pressure and hyperlipidemia and diabetes, and I adjusted their meds. And it was amazing because, I spend every day doing what I love and getting to talk to people and help people every day. And even if you have a stubborn patient, it's incredible because you get that experience and you get a little bit closer to breaking through to them. So overall, I think I'd have to say that was my favorite. It's more of the ambulatory care setting, but I loved it. It was great.
That's so awesome. Yeah, I know with the VAs too, like pharmacists have like so much like capability like at a VA, like in terms of like just what we could do, like really like you said, like practicing at the top of our license. I feel like that's pretty much every VA, like you get that awesome opportunity. So that's really great. And then just my last question, which you also kind of talked about earlier too, was how has URI prepared you for this role? I know you said with doing the cyber seniors and taking the electives, but anything else really maybe even like prepared you for like residency, like how they did with that?
Yeah, so I know I touched on this a little bit earlier, but I'm saving the best for last. So honestly, the people are incredible. Like I said, Dr. Estes was absolutely amazing and vital in getting me to where I am today and helping me find my interest for geriatrics. But I also had the amazing support of so many other faculty as well that I had gotten close to and shared my interests with, who really pushed me to get involved. And so I was able to get involved with what I love, not just say, oh, this is something I like to do. I wonder if I'll explore it in the future. It's this is your interest. Go out there and do it now and do what makes you happy and be the professional you already are. And so having that type of support has been absolutely amazing. Dr. Maggie Charpentier was another one, Dr. Anita Jacobson. I'd have to say, just to name a few of the professors that have been absolutely incredible. And I think really when it comes down to it, yeah, my classes helped. The electives helped, but really having the supportive faculty to push me to say, hey, you can be more than you think you can. So go for it. I believe in you. And it's just been amazing. And I still, take care of those connections that I made while at URI. And that's who knows where that'll lead me. But yeah, I'd have to say that you don't stop with URI. It just expands like throwing a rock in a puddle. So it just keeps expanding, and I always still go back to what I've learned even now.
I totally agree. The support system at URI is like unmatched by like the professors. Like I've had these breakdowns to Dr. Estes and like some other professors just about like how I felt like I couldn't do it. And there's always somebody there who tells me, yes, you can, which is like the greatest feeling in the world to be like reassured like that. So totally understand where you're coming for, especially being in my P4 year, like making it this far. Like I would have never thought I made it this far back when I was like a P1. So it's just really awesome the encouragement you get from everybody at URI, and it's really an awesome place to be and meet so many people like you and so many other alumni, which is like a great experience.
Yeah, and Dr. Ward too. I'd have to say the partnership between Dr. Ward and Dr. Charpentier, when they come together to help us all during residency mid-year, the big meeting, you never see faculty like that supportive from any other university. It's a madhouse usually for ASHP, but URI has their little crew that has candy and all the support words that you would ever need, and maybe a little bit of a kick in the butt too, because we all need one of those. And so they're absolutely amazing. And, that I wouldn't be where I am without them too, because, I talked to University of Maryland because they told me to check it out. So they're really a fantastic team.
I totally agree. And that was everything that I had for you. If there was anything you wanted to add at the end, feel free. But that was all I had for you.
Let's see. I think that's all I have as well. You asked lovely questions, and I love URI, and so I'm really glad. If anyone wants to reach out, feel free. I still use my URI email, so loomisamanda@my.uri.edu. They don't cut you off from that, so feel free to reach out anytime.